everybody. This is Dr. Trembush. Today I wanted to take a second and really dive into what the concept of corrective care is. We refer to corrective care through the phases of care. Corrective care is the attempt to try to fix the problems that have created your pain. Again, not everybody qualifies for corrective care. Some folks have too much arthritis or degenerative changes, or they've just let the problem go too long. And it can't be completely fixed. But some people can be. And most of our patients that come in here present with imbalances in their body that resemble to some degree this poster, that are showing that your body is just out of balance. A high shoulder, the pelvis is twisted, one knee is further in than the other, and it throws your body out of whack. Those problems commonly can be fixed. Sometimes it takes an orthotic to address an arch that is low, or a heel lift, other pieces of equipment that help to brace your body. But the concept is, if we can first get out of pain and then rehab your body, support it in any way long-term that it needs to be, that we could fix this, literally fix the problem, and therefore keep you from a lifetime of recurring pain or chronic pain. So the phases of care apply to the type of care, which is corrective care. And the phases of care are a little bit confusing, but it starts with pain relief. We call it the relief phase, and then we transition into corrective phase, then strengthening phase, and then finally is maintenance. Now, the duration of time for a corrective care plan differs from one person to the next, based on your age, the severity, the condition of your body, things like that. But commonly it looks similar. We are seeing you more frequently in the early part of treatment, and less frequently as we lead into maintenance care, which could be monthly or a few times a year even. So let's go through them real quick. Relief phase is going to be about reducing spasm, swelling, therefore pain. And what's happening in the relief phase of care is that we are using modalities to help with these problems. Sometimes we're using ultrasound or e-stim or cold laser, all of these to reduce swelling and pain. We're stretching you, we're using manual therapies with our hands, we're adjusting. Commonly, advanced physical medicine is also doing trigger point or soft tissue injection at that time to try to get medicine locally to the area and reduce your pain. Relief care is about pain relief, but the important part for people to understand is the frequency at which we apply our treatments is what's important here. Because what's going to happen is you come in for a treatment and we're going to loosen you up. We're going to reduce swelling, and therefore spasm is going to reduce and pain. But within the next couple of hours or maybe a day or two, those problems are going to start to come back. I'm sure that if you've ever done therapy in any way, you've noticed this. But within a day or two, we need to do it again. Sometimes it's a daily thing for a week or two, and commonly it's every other day, from anywhere to maybe 2 to 6 weeks of this kind of up to 3 times a week or more type of care. The goal is that we never want to put enough time in between your visits that your body has regressed back to where we started, because each visit during relief phase is building on the progress of the prior visits. So if you went for 2 or 3 weeks and you're starting to get out of pain and decided at that point that now you're going to start to miss your appointments, you're doing yourself a disservice, because you're not keeping up with that frequency in a way that prevents your body from regressing back to what was so bad in the first place. So remember that. In relief phase, it is frequent, and it's not convenient for your life. It's a commitment, but you don't want to mess with that time of frequency, because we don't want to let your body regress that much in between treatments. Now, from the relief phase, for whatever period of time we decide is best for you, we will then reevaluate at some point, and at that point your body should be 50% or more out of pain, or in less pain than when you started anyway. And at that reevaluation, we'll measure things like your range of motion or muscle testing. We'll look and see that we're making progress. Of course, you'll tell us if we are or not too, but that allows us to then know that we're ready to move on to the corrective phase of care. In corrective phase, Our goal is not so much now about spasm and swelling and pain. Of course, it's going to continue to get better, but we start to transition our focus towards more long-term fixes for your body. That means if we needed an arch support or a heel lift or a brace, that we'll have applied it by then. Start to create balance in your body. And we're also doing things with our therapies that now transition from reducing spasm and swelling to correcting imbalances. So short, tight, spastic muscles on one side of the spine, we're going to focus on stretching those. The weakened and lengthened muscles on the other side of the spine are going to start to be strengthened a little bit. And we're trying to get balance back. This lets us start to see that we can correct this problem. Now that phase might last, again, 2 to 6 weeks, but we're probably seeing you less frequently, maybe a couple times a week at this point, because we're able to put more time in between your treatments, and that's because your body isn't regressing as quickly at this point. Once we go through that phase, again, we'll reevaluate and remeasure things and listen to you and see that we are making the progress that we thought we should be making. And that's where we go into the last phase of that corrective care, which is now going to be the strengthening. And this is where we become more of a personal trainer to you. On a weekly basis, commonly, we are showing you more advanced exercises that you then take home and perform. You will have learned rehab from a stretching standpoint and self-care, activities of daily living and things that you can do at home to stay better, but now we want to teach you some strengthening exercises too. And when you apply all of that, by the end of that next 2, 4, or 6 visits, you will have learned what you need to be doing at home and have all the equipment that you need to keep it fixed. Now, many times people go through those phases of care, and what they will do at that point is they'll take those tools, go home, and they'll keep it better. But we find that it's common. Many people still need some of the things that they can't do on their own, like an adjustment. Sometimes it's massage therapy or other tools that we have here at the office that you can't do on your own. And you need to use those potentially from time to time, and we call that maintenance care. Commonly, that's not covered through your insurance. But it does allow for you in an affordable way to come in, get that adjustment on a monthly basis or every couple weeks, whatever you need at that point in your life, to keep this problem improving. Just because the pain is going away doesn't always mean that the dysfunction has left. And it takes a long time for your body to reduce dysfunction. So remember that. In corrective care, there are phases of it. The frequency depends on what part of healing that you are in. And remember this, is that the dysfunction of your body was there before you had pain in most cases. And what we're doing is we're first removing pain, and in corrective care, we want to go then and try to fix the dysfunction so that it stays that way for the long term. So thanks for listening. Hope this helps you understand a little bit more about how we approach corrective care.